Good morning, everyone. My name is Dr. Judy Cavazos. I am a clinical psychologist at UCSF Benioff Children's Hospital in Oakland. I worked for the Sickle Cell team for about 5 years, and now I try to volunteer my time doing some research and some neuropsychological assessments with our adult sickle cell patients in our clinic. And today we're going to talk about neurocognitive health throughout the lifespan. All right. So I have no conflicts to declare. And today's learning objectives include learning about the brain. I'm not going to go extensively into it because this would be a very long conversation, but kind of the main points that can help you better understand what's going on with this disease process and the brain. And then we're going to talk about why brain health is important, learn about the impact of sickle cell on the brain throughout the lifespan, and then lastly, what tools we can use to improve our brain health. All right. So I always put this as a warning because some of this information can be hard to hear. Hopefully you've already heard it before because your providers are letting you know about some of the side effects that can happen. But in case they aren't doing their job or we don't always remember everything that they say, I do like to make sure that I inform you of the things. Again, it's not to scare you, just to inform you, but it can sound scary sometimes. As a psychologist and doing work with neuropsychology, I think the brain is very important. Our overall health does include brain health, but I don't think we always focus on our brain health because, as with sickle cell, there's a big pain component to it. And so oftentimes people focus on that, which is understandable because it is something that's obviously very impactful and impacts not just the body, but everyday life. But your brain is part of your health. So we always want to make sure that we are aware of just brain health in general, and then what we can do when you have a chronic illness, because unfortunately, sickle cell does get impacted by the brain and vice versa. So it's really important to make sure that we monitor our brain health, ourselves and our providers. And unfortunately, people who generally have chronic illnesses generally have comorbidities, so like an additional illness. So for instance, oftentimes with chronic illnesses, they don't have just the physical chronic illness, but also the mental health components to it. So there tends to be a lot of anxiety and depression, maybe some PTSD from all the medical care that you receive. So it's really important to make sure that the physical brain is actually healthy, but also the functioning of the brain is healthy as well, especially when there can be more than one or two issues that we're experiencing. And especially as we get older, we tend to have more and more comorbidities. Even when you are as healthy as you can be, our body ages, and so things happen to it. And so we just want to make sure that we are focusing on what we can do to help identify the needs and manage them as early on as possible. Some things we can prevent, others we cannot. The ones that we can't, we at least need to try to do early interventions and then, secondary and tertiary interventions as well. But ultimately, we want to make sure that we provide treatments and services that could prevent some of these things as early as possible when we can. Because ultimately, making sure that your overall health, including your brain health, will help increase your quality of life as well, just quality of your life. As I mentioned, there are lots of parts to the brain, but I'm not going to go deep dive into it. I think just some things, because I am not a neuroanatomist, and I only know so much about the brain. And as humans, we only know so much about the brain. So we're going to kind of just go on the basic parts for right now. And what you'll find is that different providers use different words, so it can be very confusing. So I'll let you know like what these other things are usually referred to as well. But there's probably like several different words for the same parts of the body sometimes. All right, so we're going to focus on the three main parts of the brain, which we call the forebrain or the frontal lobe, which is here in this purple area, which is a very large part of the brain. This is our newer part of our brain. It consists of two halves divided by the corpus callosum. So we think about it as like if you think of your two fists squished together, in the middle is what we call the corpus callosum. That is kind of like an operator that helps talk to both sides of the brain. And so another name for it is the cerebrum, or your frontal lobes, or the cerebral cortex, but it is the newest part of our brain. This yellow part, which we'll get to in a moment, is what we call our old brain or reptile brain or monkey brain, because it was back in the cave people era. This is just what we kind of had. This purple part is what has grown over the many, many decades that we have lived, and includes a lot of the more complex parts of the brain. So again, the cerebral cortex or the frontal lobe or the cerebrum. So the cerebral cortex is the outer layer of the brain, because as you can see, there's lots of stuff in here. So the four parts of the lobes we call the frontal lobe, which is right here in front of your forehead. Then we have temporal lobe, which is like the side by your ears on each side. Parietal lobe is kind of like a strip that goes across the top of your head. And then back here is the occipital lobe, which is kind of your visions and stuff. Then you can see the little blue part right here is what we call the midbrain. Some of the reasons why these are named the way that they are back in the day when we first started kind of labeling all the body parts, is location. So forebrain means in front, midbrain obviously means in middle, and then the hindbrain means in back. So the reason that they labeled all of these things is so that when different people were working on a brain, like in a surgery or something, it's all in relation to each other. So the midbrain consists of the colliculi, the tegmentum, and the cerebral peduncles, which do lots of different things as well, even though it's a little small part of the brain. And then, as I mentioned, the hindbrain is this yellow piece back here. It consists of the upper spinal cord, which is right here, and then the brain stem, which goes all the way down to your tailbone. And then the nerves obviously go throughout your entire body. And then part of the hindbrain is also cerebellum, which is what is also referred to as like the tiny brain, because that's what we kind of started with back in the day. But as I mentioned, we've evolved and now we have all of this. So as we age, the brain grows and develops from literally in utero and throughout the lifespan. So oftentimes I talk about with parents and young adults that the most important part of your brain, right behind our forehead, which we'll talk more into detail in a moment, is the last part of the brain to grow. Not size-wise, more of connections is what matters to us. It stops growing between 25 and 30 years old. Science says between, mid to late 20s. I think it's closer to late 20s, because you really think differently from before that time period to after, but you won't know that until obviously you've made it past that age. But the reason why we can tell people's brain is finally more solidified is because of the choices that they make. The frontal lobe, and we'll go again into a moment more in depth to it, but it's big functioning things like planning, thinking about your long-term consequences, impulse control, lots of big things that we need to do. And that's why it's the last part of the piece to grow, is because it just takes a long time. So I always think of it as the CEO of the brain. You just wouldn't hire anybody to run the brain. You want to hire somebody who has experience and knowledge, but that just takes time. So that's why it is the last piece to grow. It's a very complex organ. It's always evolving. We're always learning new things, especially nowadays. So things that maybe we knew about 2 weeks ago may be completely different because of how science is kind of moving forward. So it's really important to kind of keep on top of brain health because it is ever evolving. All right. So we're going to talk a little bit about the functions of the brain. And again, I'm not going to go into great detail because there is just so much about the brain, but I just want to give you some information that can be helpful. So brain functions are mental processes that are linked to specific parts of the brain or pathways in the brain. So again, the brain is kind of the organ. We think of the mind as all the processes that are kind of occurring. And the brain, as I mentioned, there's just lots and lots of connections going on inside the brain. So the brain controls literally everything. Thinking, feeling, learning, memory, movement, your heartbeat, your breathing, your digestion, Literally, it is on 24/7 from the moment it starts to develop in utero until the day that we die. It will always be on. It never guest rests, except when we're sleeping. But it doesn't even turn off when we're sleeping. It just goes down to like sleep mode. So that's why it's really, really important for us to have a really healthy brain, because it is on all the time and does so many things for us. As I mentioned before, we talked a little bit about the frontal lobe, and the other lobes that are kind of the big ones when we talk about the brain. And so I just want to kind of review a little bit of what those lobes do. And this is just a very small fraction of what they do. But I just want to kind of give you some of the things because it's very complex. All right, so the frontal lobe, which again is right behind your forehead, it's the kind of the bigger part of the brain. It's the one that finishes growing between 25 and 30 years old. So it does things like focus your attention, your concentration. It does planning and organizing of your thoughts, of your movements, of your planning, like, a schedule, how to tackle a paper. Like, it plans and organizes everything. It thinks about long-term consequences. So that's why oftentimes we say, teenagers and young adults don't always make the best choices. It's because they're not playing with the full deck. It doesn't mean that we can't help them move it along and get stronger as it grows, but they're not always able to think about the long-term consequences of their actions. This part of the brain also directs impulse control. So that's why people, who are younger, teens, young adults, we don't always make the best choices in the moment because we're not always thinking long-term. But again, that impulse control is also being kind of managed by this part of the brain. And so this is just, big things, and kind of just needs lots of time to develop. But again, I always say it's not an excuse. It's more of like an understanding of this is why it's important to help people plan and organize their thoughts and their actions, sometimes talking it out with them so that we can strengthen that part of the brain. The temporal lobe, like I mentioned, was on the sides by your ears. It's one of the functions is language, such as receptive language. So that means how we understand and take in verbal language and non-verbally. And then it's also used to our expressive language skills. So that is how we literally move our tongue and our lips and our teeth to form words and sentences. And so it's how we express ourselves, literally the mechanics of it, well as the words. So those are two big parts of what the temporal lobe does, is kind of deal with language. And again, can't emphasize enough that most of these parts of the brain do not just do things on their own. They're constantly working with other parts of the brain because it's just such a complex system. But these are where like the big kind of areas lie in them. The parietal lobe, again, is kind of like the kind of a band, like a headband right across the top of your head. Some of the things that it does is sensory input. So all your senses, so taste, temperature, touch, vision, what you hear, all the things, which obviously as humans, we have millions of stimuli coming at us all the time, the things that we actually register consciously, and all the things we don't register because it's unconscious or it's kind of at the side. But because of the way our brain works, we're constantly scanning our environment, the people, our own bodies, our feelings, our thoughts, like everything is going on. Again, this is why brain health is so important, because it does so many things. And lastly, the occipital lobe is at the back of your head. It's also a pretty large part. It is your vision center. So your eyes are at the front, and so everything goes in through your eyes, but then gets processed towards the back of your head, because that's where your occipital lobes lie. So again, think of the brain as a central computer that controls all body functions, like literally every single thing. That's why when they say, when you're out doing activities that are on wheels, make sure to wear a helmet. When you're walking, make sure that your balance is good so that we don't fall. Because even though we have this wonderful brain inside this wonderful cage that is called our skull, it still can cause a lot of damage when we hit our head, even slightly, because it's not just hitting maybe just the front, but it kind of reverberates back and forth. And within the brain, we have these little pockets. And within the pockets, they kind of have little sharp edges. So it's a lot what's happening if you hit your head. So that's why we always want to make sure that we can keep our brain and head as protected as possible, because what's inside is very valuable and impacts, like I said, everything. So hopefully this is some kind of helpful points about the brain. Like I mentioned, there's a lot more. We'd have lots more to review if we wanted to know everything about the brain. But I just want to give some kind of big points so you can understand why brain health is so important. So how does sickle cell impact the brain? So as you can see, this has lots of different impacts in a negative way, like stroke, cognitive dysfunction, meaning that your cognitions aren't working the way they need to be or at a full percentage. And even if someone doesn't have sickle cell, even a typical person can have different cognitive strengths as well as weaknesses. So every person is made different regardless of their chronic illness. A lot of people have or don't even realize that they have silent cerebral infarcts, but that is, a stroke. Sometimes you don't see it unless you start noticing people's behaviors changing, and sometimes they can be very subtle. And then finally, when they look, because they never realized that they had a stroke, but when they look on imaging, sometimes they'll find them, sometimes they won't, but we'll know because some of their behaviors have changed. We have bigger strokes, like a ischemic stroke. Obviously, seizures can happen. The volume changes of your brain. It can shrink. Like if we don't drink enough water, it shrinks and gets dry. So we always gotta make sure that we maintain like our health. People can have moya moya, which obviously can cause a lot of issues. There's a lot of vascular issues that occur in the brain as well. There can be aneurysms. The white matter gets injured. The white matter is very important to our brain, as is the gray matter. Again, we're not going to go into all of those things, but you can kind of see like all the things that can happen from that sickle cell can impact the brain with. And that's just kind of like, again, the big things. All right, so we want to go a little bit into how sickle cell impacts the brain, kind of like on a big scale, and then we'll go kind of to a smaller scale. So as we all know, sickle cell blocks blood flow to the brain. What not a lot of people know is that about 20% of our entire blood volume is used by our brain. That's almost a quarter of our entire blood system used just for the brain, which means if we're not getting enough blood to it, we're also not getting enough oxygen to it. And if those two things are happening, it is impacting the brain in different ways. And for every person with sickle cell, it might impact them differently because of genetics, because of environmental things, because of medications. Like there's lots of things that impact a person's brain. So that's why we want to just make sure we again have a healthy brain as possible when we talk about our health. So unfortunately, this disrupted oxygen and blood flow to the brain since in utero, because that's when the brain starts to develop in utero. It can lead to obviously stroke, as I mentioned, silent infarcts, and again, it happens across the lifespan, unfortunately. And again, we just tell you these things so that you're aware, so that we can do as much to prevent and early intervention. It can also cause neurological impairments such as developmental delays, meaning usually these things occur before the age of 18, hence why it's called developmental, because it's what we look at what we call typical milestones that kids should generally reach at. And if they're not reaching those, again, because of organic issues or because of a chronic illness, then we make sure that they have services to help provide different types of treatments so that we can get them what they need. There's also neurocognitive deficits, things like memory loss or feeling like you can't keep up with the conversation, like people talk too quickly or not understanding everything. So those are different things that can happen as well. And even though some people may experience more severe complications than others, but all have depleted levels. So some people will be on monthly transfusions because of the disease that they carry. They have to just need more blood. And so that can also, even though it's obviously life-saving, it also, because of the iron overload, that can cause some issues in the brain as well. So we just, again, make sure we need to monitor these things because even things that can be helpful can also be a little bit harmful as well. And then making sure that we know how the brain is being impacted by our disease throughout our lifespan. Hopefully your providers are telling and talking to you about these things, but if not, here's a good time to start asking. The most commonly impacted domains that sickle cell that we've learned through research and literature and from meeting with patients is these three domains. And we call domains because they're kind of big areas that do lots of different things. So executive functioning, again, that is something, all the pieces of your brain that kind of do that is right in your frontal lobe by your forehead. So it does things like initiating tasks and staying focused on them, regulating your emotions, self-monitoring, not just your emotions, but your activities. Like, what do I have to do next? If you're doing like, let's say like you're building something, you have to think about all the steps you need to do and take in order to get that accomplished. But that's not just building something like a piece of furniture, but even throughout your day. Like if I need to go to the grocery store, I need to, get my list, get my keys, get my wallet, all of these things, even though we don't think about them as, hard things because our brain just does them automatically. For some people, it's not automatic and it is a struggle. So we want to make sure that we're monitoring these things for ourselves and our loved ones so that if they're starting to have challenges, we can say, oh, well, that is part of the disease process, but it doesn't mean that we can't do something about it, other than just monitoring it. We want to try to strengthen those things, because even if they're not working as similarly to someone who doesn't have sickle cell, it doesn't mean that that person still can't do these things. They just need to do it differently. Another big area that gets impacted is processing speed. So that is how quickly you take in information, kind of manipulate it and use it, and then spit it back out. So for instance, if you're having a conversation, you're listening to what the person is saying, maybe they're asking you a question, you have to really think about that and then kind of say what the answer is. So people with sickle cell tend to have a harder time with processing speed, meaning it tends to be slower. So what I tell people is that that's okay. You just have to be mindful that you might need to take more time to do something. So if you say like, yeah, it'll take me 15 minutes, tack on another 15, because I think any human, not just people with sickle cell, we overestimate how long it'll take or underestimate how long it takes us to do things. So when you have a disease process that literally impacts your processing speed, it's just to be aware of it, because processing speed, even though you don't think about it just as how quickly you take in information, how quickly you spit it out, but it does impact other areas as well, like visual processing. So how quickly you could look at something like a menu or your environment, depending on what type of job you have or what activity you're doing. It involves hand-eye coordination. It's related to working memory. So if somebody, talks really quickly and your memory isn't the greatest and you have processing speed issues, they might be talking too fast for you to actually take in everything that is being said. And then you might say like, oh, I just have a memory problem because I always forget what they said. But it might be that they're talking too quickly and you can't process everything as quickly as they're saying it. So you might have to say, I really want to hear everything you say, but can you slow down? We don't always love to admit some of our challenges, but at the same time, that person might not feel like you are listening to them or are paying attention or care about them because you can't remember maybe something that they said that was really important to them. So that's why I tell people it's important to help people understand the challenges that you have so that they can help figure out ways to compromise and so that your relationships go well. I put this kind of iPhone cord is to kind of explain the processing speed. So in our brain, we have all these cells and these connections. So if you think of like what we call like a nice healthy brain, think about like all this white area right here. Like you can't see what's going on underneath. But with sickle cell, because oxygen and blood aren't getting to the brain, this white kind of cord, what we call myelin sheath, doesn't get it depends, either it doesn't code it the way it needs to, or it codes it more thinly, or as you can see where it's kind of broken up, it kind of starts to degenerate. So when that happens, that signal, when it was nice and covered, it goes from point A to point B. Now, when it's not covered over here, it kind of sparks out everywhere, which means that you're not processing as quickly or efficiently as you would like. So I think that's kind of a nice way to kind of see why how processing speed gets impacted by sickle cell, and then how it impacts on a daily basis.
Hey,
And
Judy,
last,
can you hear me?
yep,
I was curious to know if we could stay on this point really quickly from a psychological perspective
sure.
with the group. And I wanted to know if there's a chance we could open it up for anybody that goes through this process where they struggle. Because I guess one of the points that I just felt like was important to think about was the confidence for somebody to advise another to repeat themselves or to let them know that they may not necessarily be processing all this information right away. I just wanted to ask if anybody,
I do.
yes, would you be able to just kind of give us some of your input on how you handle this situation and how you can help others that might be looking at this go through this process, but then feel empowered to say something?
Sure. So I struggle with processing. I struggle with retaining. I struggle with all that because I have moya, and I've had two brain surgeries that I actually had to have to help me receive more oxygen to my brain. So I have brain issues. And so yes, I always explain to people like a disclaimer, you know what, sometimes you might have to say things twice to me, or sometimes I may say, I might ask you again because I may not remember. It's just feeling enough to explain to people like who you are, like what you got going on here. I know most people are able to get things the first time around, but not me. I may need you to explain it again to me. Or even in school, like I have to get like not exactly an IEP plan because I'm in college, but I have to get like the disabled student services because I can't retain all the information they give me. I have to sometimes use a recorder for lectures and things like that. But you just have to be comfortable about telling people what you need for yourself in order for you to learn, in order for you to understand, in order for you to just process it. I know I've had a couple of situations where I did feel like, you know what, it's not even worth even going and explain myself because, you know, people get defensive sometimes. I've witnessed that. Like, I just said that to you. Like, you know, people saying that. And I'm like, okay, you know what, I have a little bit of issues with my brain. So, you know, I need you to explain it again. But sometimes I do shut down and will be like, forget it. But like you said, you have to have the confidence and you have to have, if you want to relate stuff to people, you have to have the ability to be like, to say, hey, could you explain that again? Or I didn't understand that clearly. Like, could you break it down more in details? Or could you slow down when you're talking? And even on my right side, my hand, I write really slow due to the stroke that I had in 2012. I have to tell people to slow down when talking because I, for one, I can't retain that information or process it that fast. And for two, I can't write the notes. And even then, I have to get note takers for class. And like I said, sometimes I have to record lectures and things like that. So, you know, and it is hard and it is a little discouraging, but you just have to have that confidence.
So,
If you,
Calvin, a quick question for you then. Like, uh, when did you feel like you got to your point where, okay, I'm confident, or you said to yourself, I
wait,
can't deal with it. I have to figure out, yeah, like what point was that? Was like, you know what, I'm just going to stand up for myself.
um, when I got to that point when I was, I kind of just knew kind of what I wanted to do and what I wanted to be. And it was like, in order to be that, I have to literally talk to people and tell people where my standpoint of things. I feel like it was kind of after my stroke, because even after I had the stroke, I had those. After I had the stroke, I think the stroke kind of made the damage in my brain. I was really discouraged. I was really discouraged, but I had that point when I was like, I'm ready to go to school. I have to get further. And in order for me to get further in life, I have to put aside my fear of talking, of telling people what I go through. So I
Do you have any specific practices for yourself? Any
yes,
practices that you have that help you?
yes. So I do have to read things like 5 times. I make sure I write everything down so I can go back and be like, oh yeah, I needed to do that today. Like I forget what I'm supposed to be doing. I wake up in the morning and totally forget what was on my agenda. So I have to make agendas for myself every day. And when I don't, I tend to forget the things that I'm supposed to do. Or like I said, I put things in place like recording lectures, or I'll make sure I go to the disabled student services and ask for like a note taker for class for me. But writing things down, setting alarms, and just asking people to repeat their stuff, or even recording people when things are so information and valuable that you need to retain it and remember it. You got to do stuff like that. And it takes a lot of time. And I'm telling you, like right now I'm in this book club, and I told them like, I can't read as fast as everybody else. So y'all got to bear with me. And plus I got a whole lot going on top of that. They're like, oh, well, you can use the audio book. And I'm like, well, I can't really use the audio book because I don't retain the information. I can hear it, but then I will forget everything I read. So I have to actually read it and write things down. And it takes me
Gotcha.
longer, but that's just what I have to do in order to achieve,
Thank you for
things
sharing,
take me a
Calvin.
lot longer. Yeah.
Yeah. Nancy, you had your hand raised. Just wanted to come to you first, and then we'll go to Shirley Powell. Nancy, would you like to open your mic up?
Yeah, I did. Can you hear me?
Yes, ma'am.
Yeah. First of all, to the last speaker, wow, congratulations. That's just wonderful that you've been able to do that, and that you've been able to set those sights on what you really want. I'm speaking as a former teacher and as a family member. My grandson, who had a stroke as a baby, but if his parents had known a lot of this stuff earlier, it would have saved him a lot of punishment. Punishment for losing the new jacket he just got, punishment for whatever it was, kind of typical things that kids do, but being sort of absent-minded, forgetful. And nobody, because I went to many of his appointments, nobody ever said to any of the family members, look, these are some things to look for since we know he's had a stroke. And so I'm just saying, first of all, thank you, Antoine, to you and your mom for organizing this. Thank you to everyone who's listening, but I hope we can put this in maybe a newsletter or maybe something else to get that information out, because parents and family members don't know to ask for this stuff in IEP meetings. I don't think they know that. I don't think many college students, my grandson's in college, I don't think he knows that anything that he may have like this is related to the stroke. And then there's also denial that some people say, well, yeah, I forget a lot, and yeah, I have a hard time, but no, I'm fine. I beat that old stroke, So there's a lot of things that are involved in this. So I want to thank you, and I hope we can get this information out to lots of people, because I think it would certainly help children grow up with all of these issues.
Thank you so much, Nancy. I appreciate that. And yes, we do at the end, and we'll advise you guys like how we are as an organization collaborating with other entities to develop infographics and other types of brochures that would incorporate this new information that we're constantly getting on a week-to-week basis that can help people in this community understand resources or just practices that they can go through in order to overcome certain pitfalls that they may have with memory, with speech, or just trying to get their point across. I wanted to make sure that I talked to Shirley Powell, because Shirley, you had a good, I think your question coincides with this, but it's an after effect. So can you open up your mic and ask the question, please? Shirley, are you talking? I think your mic might be struggling. Judy, just for you, Shirley asked the question, How has
Can
the
you hear
growth
me
of the new?
now?
Oh, yeah, we can. Go ahead. Go ahead, Shirley.
Okay, yeah. I wanted to know how the growth of the new brain, that frontal cortex changes our perception as it, within the common humanity, not just sickle cell, but how has it changed over the centuries about how we see life and reality?
That's a very philosophical question that I might not be able to answer, but I will say that that whole part of the brain, I know I mentioned the hindbrain, that little yellow piece. So back in that piece of the brain, it was really just like heartbeat, blood flow, like mainly like things that just literally physically keep you alive. So they didn't have language really. They didn't have all these executive functioning skills, all this other things. They had like the most basic of the brain that you can think of. And then over, evolution periods, it grew into such a bigger size. And that's why we developed language. Without those frontal lobes, we wouldn't have developed language, and our communities would have been very different. That's why people must be in communities, because we need to communicate with each other. We need help to survive. So it's been a very complex part of the brain that's developed over, like I said, the evolution periods, because we didn't have that piece. It was just kind of that smaller brain that just did the basic functions of just keeping you alive.
Okay, thank you. That's helpful. I have another question and a comment. The other question is, what is the state or the condition of the brain that impacts or influences emotions?
Oh, it's all over as well. As I mentioned, there's nothing in our brain that just does one thing. Like I always think of like your left hand and your right hand. They can both do things, but one's stronger than the other, right? Like you can probably write with both of them, but one's going to be more legible. So the more you like, if you think about it that way, as I mentioned, the brain is very complex. So there's chemicals that help release, or happiness, and so there's what we call it, neurochemicals, and that is one part of it. But then it's the wiring of like the actual memory of something goes through this, and then it gets stored in our memory. So like memories are literal chemical signals that are stored in so our memories can be visual, or they can be smell memories, and all of that impacts our emotions. And there's a lot of things that happen with our emotions where they're definitely stored throughout the brain in our bodies, because it gets things get stuck. But for the most part, like there's lots of different areas of the brain that get impact and are impacted by the emotions. I don't know if that kind of helped.
Thank you, Judy. I appreciate it.
Yeah, that helps.
good.
And I just wanted to make one comment.
Go ahead, Shirley.
As far as the hand-eye coordination, and I took tennis lesson, and the tennis instructor was like, "Oh, your form is amazing. Your blah 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 is excellent. But if you could only learn to hit the ball." So, I mean, it's funny, but it's just kind of so relatable. So, I tried golf and tennis, and I wasn't good at it because of my hand-eye coordination. So I took up other sports and activities with big balls and things. But that was the only comment I wanted to share, that I just kind of took it in stride and pursued alternative activities.
Yeah, thank you for sharing. With something like your hand-eye coordination can get better, but if you didn't know what was wrong, then you're like, what's the point? But once you know, then you can do something about it. We can't always strengthen it to make it like we're the best tennis player in the world, but if you enjoy it, then we can figure out ways to help you get that piece stronger. Even if it might not be a strength, it can still get better. All right, so kind of have you guys have noticed all of this is, complex. Nothing works alone. As I mentioned, in processing speed gets impacted by memory, and working memory obviously impacts all of these other things as well. So these are the three main areas that we've noticed with sickle cell. Again, those executive functioning skills, the processing speed, and the working memory. All right. So we kind of want to talk about the impact throughout the lifespan, because as I mentioned, the brain is growing from in utero. Usually it's the third trimester that it's really kind of working its way into becoming what it is today. And then it's throughout their entire lifespan and it's changing. So sickle cell impacts people at different parts of their life as well, starting again in utero. So I know we've talked about childhood strokes. So silent and overt strokes are experienced by 39% of children by age of 18 years of age. Again, sometimes you don't even recognize them until much later because the brain's still developing. So you won't even see how it impacted it until later on. It might just be like, oh, yeah, they had a stroke, but it wasn't a big deal. But sometimes they are big deals, but maybe not at the moment. Maybe later on, it's expressing itself differently. 50% of adults by the age of 30 have had a stroke, either silent or overt. Again, people don't always know, but the more we can make sure that we take care of our brain and these things, then we can kind of deal with them. Unfortunately, because of the impact of sickle cell on the brain, there are educational attainment challenges, learning challenges. Oftentimes people assume, I've heard this so many times, oh, it's because they're missing school all the time. That's why they're not understanding the information. I'm like, that is one piece of the pie. Yes, but it's not the only pie. They literally have a disease that impacts their brain. Why aren't we saying those things? Because then it doesn't become of this kid is quote unquote lazy or not smart enough or not trying hard enough or just doesn't want to pay attention. It's stop and think, this is a disease that impacts the brain. When they don't have enough blood and oxygen to the brain, what is it doing to the brain? Again, to a developing brain. So I think there needs to be more understanding so that teachers and parents and community members and family understand that this disease isn't just pain and impacts the body. It impacts the brain a lot as well. And unfortunately, a lot of people, and I've heard this, like a lot of our patients say, like, I just didn't think I was smart, or I just gave up, or, all these other things that really impacted their self-esteem when they could have done all these things, but just differently. So we really want to make sure that we are identifying these challenges on early as possible and then advocating for support. Through high school, there's things through grade school and high school, there's things such as an AEP and a 504 plan, and I'll talk more about that in a couple of slides. But even as Calvin mentioned, yes, she doesn't have an IEP in college, but she does have the ability to go to the disabilities office and get accommodations. Not everyone knows these things. That's why I always say, talk to each other, share this stuff, learn about these things. A lot of people want to go to college, but and they're smart enough, but unfortunately, because of the academic piece, they struggle a lot. And again, they tend to think it's them versus their illness and the impact on their brain. So the more we can learn about how the brain gets impacted, so then we can do something about it. And unfortunately, it's not just in school that we have these challenges, employment opportunities as well. So people don't have a job or are underemployed because it takes a lot of skills, a lot of brain skills to do different work. Even simple things like, go to the grocery store and be a bagger or something. Like, one, you have to get yourself there physically. Or if you have to take a car or you have to take the bus, you have to, know the directions and how to organize your time and your day. And like, there's lots of different things that occur in our everyday life that we kind of take advantage of or don't even think about, all the steps that our brain does to keep us doing all these things. So unfortunately, sickle cell impacts not just education, but also work opportunities, because maybe they're not fast enough in getting, let's say, a presentation done on time. And they're like, well, they're just procrastinating all the time. Well, it could be that you work slower, and so you just need more time. But you can get accommodations for work as well. And we'll talk a little bit more about the next slides. But if people don't know about these things, they're not going to always utilize them. And overall, because, you know, your body and your brain are impacted by sickle cell, it does impact the quality of life. You know, like we talked about earlier, if you can't process quickly, one speaks quickly to you, let's say this is your partner of 20 years and they're saying like all these things and you're trying to keep up with everything. You're like, yes, I need to do this and do that for them and do this. And you don't want to interrupt them, but you forget to write the stuff down. And they're like, oh, you just don't care. You just don't listen to me. And it's like, well, there could be a bit of that, but it's likely also all these other things that we have to recognize and realize like, no, this is how my brain works. It just works differently. I can still do these things, but you're going to need to slow things down so I can write this stuff down so I don't have to ask you again. So you don't feel like you're repeating yourself, which makes you feel like I'm not. I know it's hard to have these conversations, but at the end of the day, you're all worth it. We all deserve our respect and people to help us, to let them know how to help us sometimes. And I know it feels hard to do those things, but I always think of this was like if you were in a really bad car accident and you lost, you know, one of your limbs, obviously people would like help you and figure out how to best support you because you are now differently abled, right? But with illnesses or injuries that impact the brain and that aren't seen the same way as physical ones, then people don't understand those things. But I think oftentimes people are willing to understand and learn, but we have to teach them these things as well. And as I mentioned, you know, again, quality of life can change on your everyday things. So activities of daily living, like planning and organizing your day, thinking about time management, like all of that takes a lot of brain power. And that's if you're just doing it for yourself, let alone if you're doing it for your children, for your partner, or for your family members, with a job or without a job. There's lots of things that are going on. So this is why it's so important to keep our brain nice and healthy because it's doing so much all the time.
Hey, Judy, Janine had her hand up through this process. Do we have a chance to let her ask a question might be relevant to what you just mentioned?
Sure.
Janine, would you like to open your mic up, please?
What I wanted to say was, based on everything that everybody is, I'm an older sickle cell patient, or however you want to put it. And all of this stuff, I wish it had been available to me when I was younger, a lot younger. What Calvin A had to say was me 100%. But they didn't have all this information as I was getting older. And it's been, now that I understand it, other people don't understand it. So it makes it really difficult at my age to realize that all the things I kind of missed out on is because people didn't understand what sickle cell was. Even my own mom didn't know what it was. I found out as an adult because I was adopted as an infant. So, and my mother was an older person when she adopted me. So the things that were going on, excuse me, that were going on in my life, she didn't understand. So this conversation here, I probably should have come later in this, but I feel so much of it right now is because I've been through it and excuse me, and still going through it. So I just want to say that now, while my brain will process it. So thank you anyway.
Thank you for sharing that. I do wish that, you know, this information was around more for everyone. And unfortunately, people still don't know some of this stuff. And I'm like, it's not okay. As providers, we need to be educating our patients about these things often because of the fact that they have memory problems. They might not remember some of these things. So we need to really reinforce this all the time. And I'm glad that once someone has information, they can share it with other people. And that's how we kind of build information so that people can have these services and treatment early on, and so they don't experience what people in the past had to experience or still have to experience. So obviously, brain health also can impact on our ability to utilize healthcare services because we do have lots of appointments we have to manage. We have lots of medications that we have to manage. Especially as we age, we have a lot more of those things happening. And so oftentimes people forget to take their medications, not because they don't want to. And that of course can be part of it too, because you're tired of taking medicine. but it also be because you forgot. So it's really important to help people remember things by like setting alarms, by reminding them, because this is sometimes like, you know, diseases are just for an individual. It impacts a family and a community. And so we need to help support people who have these challenges, because I think they would do the same thing for us and they deserve it. So, you know, they oftentimes have lots of conflicting appointments and they might forget one. It's not because they don't want to go, even though sometimes they might not want to, but these things. And obviously, like having to deal with a chronic illness does put people more at risk of having depression, anxiety, PTSD, because it's a lot to deal with. And it can feel depressing or worrisome that you have to deal with all this physical health stuff, in addition to your mental health, and then everything else that's going on in your life. And fortunately, cognitive difficulties can contribute to an increased mortality, because again, you might not think about all the medications that you have to take or services that you have to go to, having to navigate these complex systems, even for someone who doesn't have learning issues, is still really hard. So I can't imagine someone who does have challenges, trying to navigate these worlds. And again, unfortunately, like because of the disease, there are often comorbidities. So we just have to make sure that we're really taking care of our brain health as best as we can. So tools to improve brain health. I'm going to review fairly quickly because Kim's going to go more into detail for some of these things. But I think knowledge and education is of vital importance. I always joke around that I went to school for 26 years because I really like learning. I know that's not for everyone, but I think the more we educate ourselves, then we can educate our families, our friends, our community, and it just keeps growing and growing and growing. Think of like a spider web. It's important to ask. If they're not telling you, then you have to ask them. And sometimes I know you don't know what you don't know, but that's why when we go and talk to do presentations, it's really important to share what you know and what you learn from your experience. It might not be the same for everyone else, but at least we can share some of these things so that people don't struggle so much, because it's not fair. Like I said, talk to your providers, ask questions. I really, really hope that they're asking or telling you these things, but they're not always. And I get it because they have lots of different things to kind of worry about as well. But you are the most important person to yourself, so it's important for you to ask. I always tell people it's more important to me than it is to them that I need to make sure that I do it again, because that's just what has to happen. So making sure you talk to your providers about how sickle cell impacts the brain and neurocognitions so that we can do prevention and early intervention. Education is, again, super important. Not just about what sickle cell does to the brain and how and throughout the lifespan, but then even knowing like what are developmental milestones? Where should my child typically be experiencing these things? Will sickle cell impact these milestones? And if they are, then what services can we get in? Because again, this prevention and early intervention could really save a lot of life, literally. Life, brain health, lives, time, energy, frustration. So making sure that we know as parents, typically what, or not even just parents, as caregivers, like what should this happening throughout this life? Like even later on, like I know that people have memory problems as they age, but what is typical versus what is not typical? Knowing some of this things so that we can get the proper support, not just being like, oh, it's not a big deal. It is a big deal. We need to kind of figure out what's going on. Like if you broke your arm, you wouldn't say like, it's not a big deal. Of course not. You would go get it fixed because it hurts and you want to use it. Same thing with our brain. It's not always telling us in the same way, but it's showing us in our behaviors and our actions and our thoughts and our feelings that something might not be going right. And so we need to get our support as well. So if you have developmental milestone issues, that their child isn't developing properly, there are Regional Center, which is an organization that helps with people who have intellectual disabilities and other developmental delays, impacted either by a disease like sickle cell or autism or ADHD. So that's something that people can look into for when you're below 18 years old. For academic achievement, again, Individuals with Disabilities Education Act is a federal law, so it's called the IDEA Act. It requires schools for kids under 18 to get IEP and 504 plans. The schools won't always tell you that they should get them, but as parents and caregivers, it is our responsibility to learn these things and get the help. So making sure that they get that, not just for like extra water, or they can go to the bathroom as often as they need, but do they need more time on their tests? Do they need a one-on-one tutor? Do they need someone to record this for them? All of these things are in place. We just need to utilize them more. And then it's not just in like grade school and high school, but there is things that you can do when you're in college or grad school as well to get support. Like there's disability services, they can help get you accommodated. They do want to see the paper trail throughout your life. Not everyone always has that because they didn't realize that they had these challenges until later on, but we can help support you with these things. And then for employment, there is the Americans with Disability Act, which is the ADA. You also can get services and accommodations that are reasonable from your employer. You do have to acknowledge that you have some challenges, and I know that's not always easy to acknowledge, especially when you don't want your health, business out there for everybody. But we have to think about what's going to be more helpful to get these accommodations so that you can stay in a job, so that you can have money and financial security, as well as like you like your job. So thinking about those things. I know it's not always easy, but it can be helpful in the long run. Advocacy, we kind of talked about this earlier, like Calvin A mentioned, like you have to stand up for yourself. I know it's not easy, but it's so important. I think any of us, if there was like a 2-year-old child in front of us and this kid needed food or shelter, anything, we would absolutely do everything in our power to help that child. Why wouldn't we do it for ourselves then? So it's really important to believe that we advocate for ourselves and our loved ones, because that's what we deserve. This should be a right, not a privilege. How you feel matters, what you say is important. You're the expert on yourself. Making sure that you assert yourself so you can get your needs met is really important, because advocating for self will lead to overall adjustment. It increases your health related quality of life, it increases independent living skills. And I know all of us like to be independent. And so all of this just helps for your own self, but also you model that for other people so that they start advocating for themselves and for others as well. Make sure
I just want to break in here for a second, Judy, and say, I just wanted to piggyback on what Janine had said about having this information, because my son has passed on, and had I had this information earlier on, things I'm certain would have been much different. And I really appreciate the information I'm getting now, because I can pass it on to other families and their children. But it's just so pertinent that, in the process when children are born with sickle cell, that information is conveyed to the parents now, and we've been testing since 1990 with children, with the babies that are born, to make certain that, or to know what their status was. And so I'm just really hoping that this information is being shared, at this point, to all the families with children who are living with sickle cell disease. And I just thank you so much, because I didn't know a lot about sickle cell when my son was growing up. And I didn't get a lot of information. I got routine information, but I didn't get the whole idea about how his mental would be affected, and how he had so much difficulty in school, and I didn't understand, but listening to everything that you're saying today, it just makes so much sense. And I wish I had gotten this information sooner, but I appreciate, you and Kim for what you're doing. And I just wanted to share that. That's all.
Thank you. Yeah, I wish people had more information as well. And that's why I think we do things is like, just the more we let you know, then the more questions you'll have, and that gives you more information. So it's really important to share these things when you can. And not even just with people who don't have chronic illnesses. Like a lot of this information could be useful for anybody, but we don't share these things. And I am a big believer in sharing information. Also a big believer in self-care. It's been a hard 5 years recently with the pandemic and everything else that's been going on, but that's in addition just your lives in general. So it's really important to take care of yourself. So exercising, sleep, nutrition, really, really important things, but they're the first things to go when we are stressed out. You sleep a third of your life for a reason. It's because you need, like I mentioned, your brain is on from the moment you are born to the moment you die. It's working so hard all the time. So let it rest when it can. Getting good sleep is really important. Also, it helps increase your good hormones. It increases your oxygen and blood flow when you exercise and you're eating healthy, which if you have more blood and oxygen flow to your brain, that helps improve your memory and attention. It also decreases your harmful hormones that like adrenaline and cortisol when we're stressed out. So literally exercising helps sweat it out, those things. So there is lots of benefits to just simply exercising, sleeping well, and eating well, and staying hydrated. Mindfulness and meditation have proven to increase attention and concentration and to relieve anxiety and depression. I know that they can be very hard. I try myself and it is hard, but there's different ways to, you know, be mindful and to meditate. You don't have to just sit there quietly and like think of nothing. There's lots of different types of meditations and I encourage people to try them out. 2 minutes even is better than nothing. There is lots of research that says it not just helps your physical health and your mental health, but like it even helps like your heart, your heart regulates better. So it's not pumping as hard and it's not stressed all the time. So that helps a lot too. Therapy. You can actually go to therapy, not just to talk about your anxiety and depression and the pain and all those things, which is definitely helpful, but also they can help you figure out how to increase your executive functioning skills. So how to pay attention, how to focus, how to plan and organize your thoughts, your day, your tasks, all those things. Making sure you engage in fun activities. So brains can be strengthened in so many ways. Reading, writing, playing instruments is the one brain activity that you can do that requires all parts of your brain. That's the only thing that we know of that really helps the brain in all the ways. Learning new things can help improve your brain. Doing puzzles, games, photography, knitting, all of these things can help strengthen your brain. Even though they don't seem like they can, they absolutely do, because those are a lot of different skills that you're using. Nature, going outside, it helps decrease your anxiety. And then obviously walking helps increase your oxygen blood flow. So that puts you in a calmer state. And when you're in a calmer state, you can think more logically. And support systems, they're very, very, very important. I always say it's not about the quantity of how many people you know, it's the quality of how many people you know. Making sure that you have a good support system and that they understand what you're going through and can help support you. And then services and treatment, again, make sure that you go to your doctor, your sickle cell provider at least once a year or however off schedule, as well as your PCPs, not just your hematologist, but your PCP as well, because both of them need to kind of check in and chat. Ensure that they're both talking to you about health, and if they're not, then you tell them that you need to talk about your brain health. That is their job. They need to figure it out. Oftentimes they'll also refer you to neurology, pulmonology, because again, if you're not getting enough oxygen to your brain when you're sleeping, that's going to impact your ability to remember and get good sleep and pay attention and all those things. Get referred to a neuropsychologist or a psychologist, ophthalmologist for your eyes, PT, OT, speech and language, vocational rehab, other types of rehabs. All of these things can help support your life in different ways. Making sure if, a lot of people with sickle cell have sleep apnea, so making sure that you have a CPAP or you're understanding what other things you can do to get the most oxygen to your blood, to your brain at night while you're sleeping. Again, exercising, nutrition, talk to a dietitian so they can help you figure out. I know often people with sickle cell say it hurts to exercise, but we have to do something to get the body moving because it's going to hurt more if you don't move. There are things such as cognitive rehab. If you've had a stroke, they are limited and they can be very expensive, but they do exist. But there are different ways to kind of access those things as well. Things like psychotherapy can help, like I said, you can help manage your feelings, but also help different skills to improve your executive functioning and other parts of your brain. Things like CBT, which is cognitive behavior therapy, helps figure out how you think, how you feel, how you behave, because all those impact each other. And then always got to make sure that if you feel like someone is having issues with learning, attention, behavioral issues, socialization, or emotional control, like all of these things at any point, not just as kids, but even as adults. Or if you've had a brain injury or a trauma or a stroke or other physical brain issue, when you've seen some changes, but we don't understand why we've seen these changes, either behaviorally or cognitively, making sure that we get you referred to a neuropsychologist to do some testing so that they can figure out what's going on and how to better provide support and services and referrals. Because we don't talk about a lot of this, but it should be a right, a healthcare right. It's currently not, and they're very expensive services, but the hope is to build them within our clinic so that you guys can have healthy brains. In summary, I just want to say, like, you have to understand that you are important, that your brain is important. There are several ways to engage in the prevention of, early intervention of, and treatment of brain and health challenges from in utero throughout your life. We just have to ask those questions and keep asking until you get an answer, because not everyone might know it right away, or they might not think it's important, but it is important. Lastly, just want to acknowledge the families and individuals living with sickle cell, everyone here who listens to my presentations and hopefully likes to share them with other people. Can't do this without you. Some of my citations about the brain stuff. And then lastly, just want to thank you for listening.
Awesome. Thank you so much, Nadina. I appreciate that. Good afternoon, everyone. Thank you so much for being present today and participating in today's discussion and topic. We are going to just go right into my presentation in the essence of time, but briefly, for those of you who may or may not know me, again, my name is Kim Major, medical social worker for the Adult Sickle Cell Program at UCSF, Benioff Children's Hospital in Oakland. In addition to primarily working with our adult population, I also work very closely with our pediatric sickle cell program, providing transition support to our transition age youth to help them prepare to move forward from pediatric-centered healthcare into adult-centered healthcare. And so Dr. Cavazos has already given us a real wonderful overview of the brain, the importance of brain health, and some impacts that can be as a result of brain trauma or brain injury. Next slide. I just added this particular next slide that really confirms and reiterates the importance of the brain-body connection. There's been a lot of studies, a lot of scientific evidence that really speaks to the brain-body connection, talks about the changes in our brain and how those changes in particularly affect our thinking. Also, there are changes in our physical health that may affect our brains. And so collectively, how those particular traumas or injuries can impact our overall functioning and well-being. So with that, my goal of today's presentation is to be able to discuss specific resources across the lifespan for persons or individuals living with sickle cell who have maybe experienced a brain change in order to help enhance and improve their lives. So we will specifically be talking about work, school, community, and financial resources, okay, that could potentially help support you in improving your overall quality of life. So here's just a quick look at the particular resources that we'll delve into today. So Social Security income, Family Medical Leave Act, and again, some of these Dr. Cavazos briefly touched on, and I'd like to be able to dive a little bit deeper. And certainly if there's any questions that you may have, I don't know if Antoine would like to have a didactic for this particular portion of the presentation or save the questions until the end. Either way is fine by me. We'll also look at work accommodations letter, school accommodations or IEP, students disability services, Department of Rehabilitation, and then Center for Independent Living. So let's just dive in to Social Security income. Some of you may or may not be familiar with Social Security income, but essentially what Social Security is, it's a federal program that provides monthly payments to individuals with limited income and few resources. It is for individuals that are 65 or older, as well as individuals of any age, including children, right, who are either blind or have a disability or multiple disabilities. Typically, you are able to apply for Social Security, or one of the stipulations is that you don't earn more than $1,971 a month, each month. So a lot of individuals have asked questions directly to me to say, well, Kim, am I able to work and also collect Social Security simultaneously? Yes, the answer to that question is yes. You can actually work and receive Social Security benefits. And how that actually works is it's at the discretion of the Social Security Administration. So you would definitely need to apply. Next slide, please. How are monthly benefits or payments made actually depends on, one, your income, your living situation, things you own, and then a number of factors. In order to request an application, you need to call the Social Security Administration directly. An application can take approximately anywhere from 7 to 10 days to be mailed out from the Social Security Administration. Because the application is pretty robust, I would definitely encourage you, if you so desire to apply for Social Security, to complete and submit that application as soon as you can upon receipt. And why I say that is because the determination for eligibility benefits can take anywhere from 30 to 90 days or even longer. Some patients actually, or individuals, think that the hematologist office or the PCP office or the sickle cell specialist makes the determination for the eligibility of benefits. However, it is not. It is at the discretion of the Social Security Administration solely. Next slide takes a look at the Family Medical Leave Act, otherwise known as FMLA. And FMLA is actually a state leave law that allows eligible employees of covered employers to take unpaid leave and job protected leave. So based on your medical condition, you actually are able to take leave to help care for yourself. So if there's regular routine medical appointments that you must attend, maybe you are receiving blood transfusions every 4 to 6 weeks, it is important that you are accessing the necessary health care that you need in order to stay healthy. And so in order to be able to protect your job, you do have the option to be able to apply for Family Medical Leave Act. Now, who's eligible? Again, if you have a medical condition such as sickle cell, you most certainly are eligible to receive. Some of the stipulations are that you must work for an employer to whom FMLA applies. So there are some jobs in the community that do not offer FMLA. So if you are in the job seeking business and do not have a job, but you are interested in becoming employed, one of the questions that I may recommend or suggest that during the interview process, you ask if this particular job offers medical leave coverage, okay? You also must be employed by the employer for a minimum of 12 months. So either 12 months or over a year. And you have to have worked at least 1,250 hours during that 12-month period before the start of the leave. Again, there are all these various policies that are applicable to the Medical Leave Act. So again, you must be employed with an employer where there are a minimum of 50 employees. Because if there's a job that only, an employer that only employs 20 to 30 or even up to 45 employees, they are not going to offer FMLA. Next slide. So work accommodations letter, and this is important for both our young adults and our adults who are gainfully employed or employed in general. If you have suffered a brain injury, a brain trauma, or you have challenges just in general with your medical condition, a lot of patients don't know and don't ask, but if you're employed, you do have the right to ask for an accommodations letter. And specifically what this letter is a letter from your primary care physician, your sickle cell specialist, or your hematologist that is written either by the physician or even the social worker to outline specific accommodations to help you continue on your work journey without any interruptions, right? So some of the examples of the accommodations include perhaps maybe a reasonable period of leave from work, access to water and juice at a workstation. I definitely have encountered a lot of patients that have jobs where their employer does not allow them, for whatever reason, to have water or juice at their workstation. Maybe it could be, they're fearful of accidentally having liquid spill on some of the devices and ruining the devices. But we know the importance of staying hydrated for a sickle cell patient. So we could potentially write letters to support your request to have access to water and juice at your workstation. Additionally, another important accommodation that I regularly see is extra time for bathroom breaks. There are often jobs that have policies around the number of breaks that an employee can take, maybe 2 in an 8-hour work shift or so forth. And for sickle cell patients, they have sometimes challenges concentrating their urine. So they're not able to just maybe go once or twice within the work shift. They may need to actually go multiple times throughout their shift. So that is another accommodation that you can also request, right? So a change in your work schedule, removing physical barriers, changes to your computer setup, tools, equipment, or training to help you with your job. And then also the opportunity to work remotely. I know that COVID has definitely changed a lot of the way in which many companies are rolling out their employees' ability to be able to complete their job functions. And that includes the ability to be able to work remotely. And I just would like to go back for a moment to removing physical barriers in case anyone may have a question about what that specifically is. So there, for an example, I have a young lady that I was working with that worked for a major car corporation, i.e. Tesla, and she was required to stand at a kiosk for multiple hours of her shift. She explained to me that there were a large gap hours where the customers weren't coming in, but she'd still be required to actually stand at this kiosk, even though she's not working. She's just standing. This particular patient had AVN of the hips and just had hip and leg pain in general. So standing on her legs and hips for a prolonged period of time definitely impacted her work. So we were able to write a letter of accommodations requesting her support to be able to sit during those downtimes rather than stand for that prolonged period of time at the kiosk. It just makes sense, right? Why would you have to stand there for hours in pain if you're not actually engaging in clients and customers and work and so forth? So these are just some examples of accommodations that your medical staff can support you with in order to help make the job easier for you. So our next slide actually takes a look at school accommodations for our school-age children. And Dr. Cavazos also briefly touched on this, the individual education plan, otherwise known as the IEP. And so an IEP is basically a legal document under the US law that's developed for each public school child who needs special education. And it's simply a map that lays out special education instruction and support and services to a student who needs to thrive in school. There's lots of school personnel and parents that are involved in determining the required special education and related services. And again, this is specifically for pre-K through 12th grade who attend public school. And again, an IEP is an educational program designed to help meet the student's unique needs. It's created through a team of the child's parent and the district personnel who are knowledgeable about the child's needs. And again, it's a written statement describing the student's present educational performance, their annual goals for development, and specific services to be used to help this child acquire the necessary tools that they need to be able to thrive and strive in their educational performance. This slide just gives us sort of a quick overview of the team players that are involved in the IEP meeting. Of course, there's parents or parent, caregiver, special education teacher, the general education teacher, a representative of the school or the school district, a professional such as a therapist. I know that Dr. Cavazos and I have a history of working together, and I believe she has participated in prior IEP meetings for some of our younger sickle cell patients. And then a specialist or provider that's invited by the parents to attend the IEP meeting. And then, of course, the family has the right to invite a friend or an advocate, or even a CHW or a navigator to help support the parents in this particular process. Next slide, please. So essentially how the IEP is, the development of the IEP is that the clinic social worker or the clinic psychologist would actually provide a letter directly to the parent with a summary of the neuropsych testing results. And then the parent is responsible for providing that letter directly to the school to initiate the IEP. In that letter and within that body of the letter, recommendations from our medical team or the sickle cell medical team are made to have the IEP testing. So within 30 days after eligibility is determined, the IEP team must meet in order to develop an IEP plan for that student. And obviously, parental consent is required to provide services that have been outlined in the IEP for the student. So here, this particular slide actually focuses on college level students. So I know that Calvinae, and she may or may not be on the call still, actually wonderfully, eloquently talked about some of her challenges, and that she actually accesses services through the Students Disability Services Program. And so what the DSPS program in short is a program that provides supportive services and educational accommodations to students with disabilities to have full and equitable access to the community college experience. And the next slide will talk specifically more about what particular accommodations can be requested. Additionally, there is another program called the Academic Accommodation Plan, AAP, which is developed for each student that is served by the DSPS program. And that program actually defines the student's educational goals and outlines the support services and academic accommodations to be provided to address the student's specific disability-related educational needs. So here, this particular slide actually looks at a few of the examples that can be requested through the DSPS program. So preferential seating, so near the front door or the front of the class, if there are visual changes as a result from the brain injury or brain trauma. Prior to that, the student may have been sitting in the middle of the class or the back room of the class, but after the injury, maybe they actually need to be sitting closer to the front of the class in order to be able to focus more or to be able to see the board. Note-taking assistance is available, text assignments in alternate formats, extended test-taking time, or separate quiet room for testing. And again, all of these accommodations can be designed talking with the student actually talking to the school counselor, right, to help develop the specific accommodation and needs. So our next resource is the Department of Rehabilitation. And the Department of Rehabilitation is a community resource and organization that focuses mainly on two things: helping individuals with disabilities either find and obtain employment or helping them get connected to school or to a vocational program, right? So they really tailor their services to each individual to ensure that a greater chance of success in the work arena or the school arena. Some of the services that the Department of Rehabilitation offer are career assessment and counseling, job search and interview skill, dependent living, career education and training, and assistive technology. Again, some of the services Additional services that the Department of Rehabilitation can assist with is even paying for college and textbooks. So a lot of our patients don't know this, but this is really a wonderful program that can assist with college and textbooks. College tuition in the state of California, even for community colleges, has gone up. So I would encourage all of our young adults, or even our adults who are looking to further their education, to really take advantage of this particular program. Again, they also offer job training and tools, support services like childcare and or transportation. And then they also work with clients to connect you with other people or groups that may be able to assist you. So within the Department of Rehabilitation, they work under an umbrella that have other services within the Department of Rehabilitation. Like, for example, the center, not the Center for Independent Living, but Voc Rehab is a program under the Department of Rehabilitation. But our next slide actually is another wonderful community resource, and it's the Center for Independent Living. Center for Independent Living was actually created over 50 years ago. It was created and run by individuals with disability, and they do provide advocacy programs and services in the support of rights and independence and inclusion of individuals with a diverse and array of disabilities. So physical and emotional disabilities as well too. Next slide, please. Like regional center, or excuse me, like the Department of Rehabilitation, the Center for Independent Living also offers core services, which include information and referral, independent living skills and training, peer counseling, individual and systems advocacy, services that facilitate transition from nursing home and other institutions to the community. And they also facilitate transition of youth post-secondary to life.
Kim, can I just jump in here for a second?
Absolutely.
Etta Carter wanted to share a sickle cell binder form. If you check the chat box, but I just wanted to see if Etta wanted to speak a little further about this particular link and the information that is available.
Sure.
Etta?
Hello, good afternoon, everyone.
Good afternoon.
This information was sent to me a while back, so I just wanted to share it. It has different forms of for schools and jobs and things of that nature. It's from the Sickle Cell Coalition, I think it's called, and I just wanted to share that with you guys.
She put the link in the chat box.
Awesome.
Yes, I'll do that right now.
Oh, yeah, you did already. You can do it again. That'll be fine. But I just wanted them to I don't know. You sent that to me. Yeah. So send it to everybody.
Okay.
Great. Thank you so
Thank
much.
you. Thank you so much. Thank you so much. As Dr. Cavazos indicated, it is important for patients to be able to gain knowledge about the necessary resources to help them move forward in life and to improve their overall quality of life. So the more knowledge, the better. So thank you for sharing those resources.
Absolutely.
So
No
this slide,
problem. Thank you.
you're welcome. So this next slide is just a continuation of the services that are offered for the Center for Independent Living. There's benefits counseling. So again, we've touched upon Social Security disability benefits. So they offer support to help you learn about these programs and learn about your potential eligibility, state disability insurance. So if you have a prior work history, state disability insurance, and let's just say you have a prior work history and then you end up with a brain injury or brain trauma that renders you unable to work because of your medical condition, you would actually be eligible for state disability insurance. Other benefits include Medi-Cal and Medicare. They also offer housing assistance where you can meet with a counselor to discuss various housing options that are actually available to you. They can teach you how and where to search for affordable and accessible housing and housing assistance. And then they also, in general, just offer information and referral about a wide array of disability-related issues and services just within the community. So again, they do offer peer specialists that meets with clients on a one-on-one basis, whether that's in person or virtually. COVID has definitely lightened up. And so a lot of community organizations are now allowing clients and patients to come in to their offices. So I do think that this is an important opportunity to be able to go in or be able to meet with a peer specialist online to help you develop and meet your goals. Some of the additional supports that they can offer is teaching you ways to help advocate for yourself in the areas of housing, employment, medical settings, and other areas. Just the ability to be able to advocate is so essential. It's so important. If you are equipped with the knowledge and tools to be able to advocate, that will help improve your life and open up doors to learning specific resources that can meet your needs and help ensure a full, wonderful life, right? Connecting with peer support groups. Again, a support group like this is so wonderful. Having someone to be able to talk to that shares similar experiences, share similar resources. Maybe there's someone in the sickle cell group that may have more knowledge or experience with a certain issue or challenge that you are experiencing, right? So being able to connect with peer supports is extremely vital and extremely critical. Additional examples that they're able to offer is referrals to other organizations within the Center for Independent Living program. And then they also teach the ability to navigate accessing barriers with a person that's living with a disability. So whether the barrier is physical or informational. Thank you. And I know I was going a little bit fast through those slides. I just wanted to be mindful of everyone's time. And I know that there may be questions, so if there are questions, please don't hesitate to ask. And thank you so much.
Thanks, Kim. This is Calvin A.
Hey, Calvin, thank you.
I wanted to say I have a support group. And I do refer a lot of people to Nadina and also Cayenne Wellness for extra support and
Awesome.
to have them engage in it. Like those are like my resources. They are this community-based organization specifically is a main resource that I refer patients to get hooked up with for client assistance and everything. But I think I will start. I would like if you could send me your slides so I can just go and look up things like the disabled student service, not the disabled student service, but this service of disability, the rehab program, because I'm in that rehab program. And yeah, I'm in the rehab program right now, and I'm actually going through the process of getting them to pay for my education, even though I'm kind of on the line about being a nurse or a social worker. And I want to talk to you about that now too, because I'll talk to you about that later. But I think I want to go to the work route because I'm tired of nursing. I've been doing it for almost 14 years now. And I kind of pooped out. So I think I want to be a social worker now.
Okay, well, let me just jump in here and say, Calvin A, and to everybody on that's on, that we're going to have a presentation from the DOR in August.
Oh, wonderful.
Oh, yeah.
That is awesome.
I didn't just get connected, but I got some information from them because they have a vast amount of resources and services available to people living with sickle cell. And I don't know how many people living with sickle cell know this, you know?
Right.
I just made this discovery and I'm really appreciative of it all. And they're willing to do a lot of work. I mean, because they already have it in place.
They are.
Yeah. So just know, in August, they
gotta be on top of it too. You gotta actually come with what you want to do. Like, you got to
Right.
have your mind made up, because
Absolutely.
you're kind of straddling the fence like I am right now. Then
Right.
it's like, okay, we got to put it on pause. And then another thing about the Department of Rehab is they only offer it for a certain amount of time. And I kind of hate that, because it's like, when you have sickle cell, you don't know when stuff is gonna happen. Like, last year I ended up in the hospital and having to carry around a machine, so I didn't get as much as my educational goal that I wanted to get done. And so if they only give me this amount of time to finish it, then I'm like, hey, I might need a few more years. You know what I mean? But the lady that I was talking to was like, well, we don't do over this many years. And I'm like, well, it's people with sickle cell, they're going to need more time, because we have to go at our own pace, like, that's kind of discouraging, but I'm still going to sign up.
Right. And I'm so glad you brought that point up, Calvin, because typically with the Department of Rehabilitation, they do want you to have a level of preparedness, right? And to follow up once you're assigned to a career counselor there. They want you to be able to participate in all the scheduled meetings. And if you miss, several meetings or a few meetings, they do have the tendency to sort of close your case. So I would like to just reiterate what Calvin is saying, that it's important before you sort of make the decision to access services through the Department of Rehabilitation, to make sure that this is something that you want to go forward with, because they will provide the support, right? But they do want to make sure that you are also going to do your part and follow up as well. So thank you for that, Calvin.
I had a question.
Sure.
Question?
Is it okay to speak?
Sure.
Oh, okay. Being an older person and going through a lot of things that, without support, I really need support. I'm living in Sacramento, or Elk Grove, outside of Sacramento, and I don't have any support. And I went through a lot of things by myself, and I was wondering if I could get some counseling. I've been very depressed. I did work, a large, like 13 years of my life, and was on Social Security, and was able to get not make over $1,000. But then there was a point in time where they told me I had made too much money and that I owed $23,000 back to them. And I got that straightened out. But then they said I only owed $4,000. But I was working for Franchise Tax Board, which hire people that have disabilities. And so I basically retired from there. But I went through all of the, without support. And is there somebody I could talk to, a therapist, or because
Carolyn, the
Absolutely.
the Cayenne Wellness Group in Southern California offers free counseling for people with sickle cell. And you're in Sacramento, so Stephanie Lopez is the person that took Hope's place, and I'll look for her number and put that in the chat. But if you contact them, they will provide free Uber rides to medical appointments, free counseling services. So those are like some of the benefits that you would be able to take advantage of right away as soon as you do their paperwork. But I'll put that information in the chat. So that's an excellent resource for anybody with sickle cell.
Thank
you, Ms. Wanda. And they do offer therapy over Zoom as well, too. So if that's more convenient for you, that is a perk and a plus.
Oh,
I have been participating in their therapy for almost a year now, over Zoom. And all of their therapists, I'm told, are required to have training related to sickle cell so that they have you know, extra, I'll say, sensitivity when it comes to working with people with sickle cell, in addition to, you know, having their background as a therapist. So
Okay.
it was so
Yeah, that
wonderful.
would sounds great. So
And
you would send me that information?
Yes, I'm going to put it in the chat. I'm going to look for it right now.
And
And put her
Mary,
number
you
in
can
it.
reach out to our organization as well for support and assistance, depending on what your needs are. So just know that Sickle Cell Anemia Awareness here in San Francisco
Okay,
has some resources and services that we can assist you with. So don't hesitate to reach out to us as well.
okay,
Okay, and I'll be certain that you get the Cayenne Wellness information. She's putting it in the chat box, but in case you don't
Yeah.
get it, I'll be certain to send you that information so you can reach out to them directly. Okay,
okay. Appreciate that.
sure, no problem. And any other questions or any issues that you might have, don't hesitate to give us a call. We don't necessarily have all the answers, but we can help you to find them.
Okay, appreciate that.
And thank you so much for your bravery and just speaking out to the group. I
Yeah.
really appreciate that.
Absolutely. And
Yeah.
anybody else who has any issues, by all means, please send us an email. We're here in San Francisco. I don't know where all of you are located, but we do what we can to help the sickle cell community. And it doesn't have to be right here in San Francisco. We try to take care of the Bay Area. And I recognize that there's minimal resources in Sacramento, Maryland. So I understand your issues. You're not the
Yeah.
first person that I've spoken with sickle cell that says the same thing, and we're going to see what we do for the future. So you keep praying that, you know, we can get a CBO, community-based organization up there to assist people living with sickle cell.
Because I go through Kaiser, and I don't have a hematologist. I have an oncologist, so I don't think I get the proper care that I should be getting. And I've just dealt with it, you know, throughout the years. But I don't know. I guess I could go through UC Davis. I'm not sure.
Right.
Now that I'm 65.
We can take a look at the medical, your medical home options that are available to you up there. And, you know, you can
Okay.
always reach out to them and see if their service happens to be a little better than what you've been dealing with. But yeah, I know it's very lacking up there. It's unfortunate. It is.
Yes. Yes.
And Miss
Okay, I
Marilyn,
appreciate it.
I just like to also offer and add that we do have a handful of patients that do access services through the UC Davis Center, but not with Kaiser, but because Kaiser is its own sort of institution, right? So just one recommendation is that you may even just call and speak with one of the Kaiser representatives, or even your primary care physician at Kaiser, to see if they would offer you one comprehensive referral for one comprehensive visit at UC Davis. Just see if that is something that potentially could happen once annually. And maybe that particular hematologist can maybe consult and collaborate with your current primary care physician to sort of orchestrate recommendations for your healthcare.
Okay. I appreciate that.
Sure.
Great. Wonderful. See, this is the best part about, you know, having these sessions. And like Cavanagh, she has her support group meetings monthly, and it's good for everybody to get involved and get the necessary knowledge, because that's the ticket. And that's what empowers you to be able to move forward to make the decisions that are necessary for your life. And all this information has just been very overwhelming for me, but it's great to hear. And I'm so glad that there are so many people on and getting this information. And
Nidina, real quick, Jasmine had something to add about a program that she wanted to share with everyone if they didn't see it in the chat. Jasmine, can you open your mic up, please?
I don't see Jasmine's name. Did she leave?
I'm right here. I'm still here. I'm still here with everyone.
Oh, okay, Jasmine, go for it.
I'm trying to get my camera together. Hey.
Hello.
So Yeah, I currently, well, I attended it last year. I had a baby in 2021 and he was diagnosed with sickle cell. And the following year, my pediatrics, his pediatric social worker in the sickle cell department teamed me up with um, the sickle cell disease, the foundation of it. And it's a group, it's an organization that helps families with children or individuals, adults, what have you, with sickle cell. And one of the things that they do is they have this program. It's about, I want to say, about 10 or 11 months long, and there's different sessions, and each different and in each session they talk about different topics. So whether that's medication, whether that's what we talked about here about school and education, IEP plans, they talk about pain management, they talk about mental health care for the caregivers and also for the children. So there's different topics that they talk about. And like I said, I attended a whole year of it, and it really helped. And I'm listening to a lot of individuals here today that shared that they wish that they would have had the information. And I agree too, because when I was first told about a sickle cell in general was with my first son, and they said I had the trait, but they never went into detail or gave me information about what that meant, like what it could snowball into, what would happen if I had a child with sickle cell, da 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 da. So when I had my second child recently and found out he had sickle cell and I came into this group, it became very helpful. It opened me up to a lot of things because, like I said, I was told the minimal about sickle cell. I didn't even know that there was all of this going on here. Like I thought it was just pain and that's it. Like I didn't know that it was this serious. So this group, it opens up caregivers, parents, grandparents, whoever, to just this knowledge of what they're learning. So they're trying to keep up with it. So for instance, they keep up with Children's Hospital, the handbook that they give out. They keep up with that handbook every so often. They revise it and they add new things that they found. So last year they just started the revision of it. And so it's just very helpful in general. So that's why I said, if you have any babies or anyone that has babies and they're looking for information, that group is very beneficial, very beneficial. And then like there's guest speakers. So there might be a nurse that comes in and talks about how to really manage pain, or there might be a psychologist that comes in and talks about things that we talked about here. So you really get a lot of information. That's all I had to share on that.
So Jasmine, can you put that information in the chat box?
Yeah, I'm actually going to try to put a flyer in the chat because actually the group is open now for registration. So I was trying to get it out to as many people as I could.
Okay, yeah, well, definitely. And if you, I can give you my email and you can send it directly to me.
That's even better. I can do that because there's a link that you can click on the flyer so you can either take you straight to registration.
Okay.
Okay.
That's crises, CRISIS, at SCAASF.org. Looks like, let's see. Anyone has babies? Okay, cool. All right. Did you get that, Jasmine? Stephanie Lopez. Okay, that's good.
Okay. Hold on 1 second. Okay. One more time. Sorry about that.
No worries. CRISIS. At SCAASF.org.
.org. All right, I'm gonna send that to you now.
Okay. Okay, does anybody else have anything they'd like to share? Before I turn it over or turn it back to the moderator. Moderator, are you there?
Yes, ma'am.
Okay. Okay, so it's you got the floor, son.
Okay, so thank you so much to our wonderful presenters for providing us with this awesome content. like there was like it had been expressed in the chat, these slides will be available for the participants of this webinar. Please do us a huge favor and fill out the questionnaire if you have not. The link is still in your chat box. Like I mentioned at the beginning of this webinar, this is one of our primary measures or instruments that give us the opportunity to show how our program is moving along throughout the year and how our participants are taking to the information that we are providing and whether it's valuable to them. So obviously with us trying to get as many collaborations, sponsorships, and working relationships as possible throughout the year, this is one of those important tools that we use to show them that we have something of merit. Please make sure that you remember that this was a recorded session. So there will be a posting in the coming weeks of this entire webinar on the YouTube channel. If you don't know, if you haven't subscribed to it yet, all you have to do is go to the YouTube website. And when you get there, there is a taskbar for searching at the top of the page. And you would just put in SCAASF and it'll come up. You'll see us. Just remind yourself, if you put that in, the logo that we have is a white and red shield with a 2 sickle cell. Well, I believe there might be 4 sickled cells that create a ribbon.